Hello, this is Dr. Farley. What I'm going to be going over with you today on this video is about andropause and the problems that men start to see with testosterone levels that are out of balance. First thing to explain to you is, everyone believes that the story goes like this, that as you get older, you're going to naturally have your hormone levels, especially the male hormone levels, testosterone, start to decline about 30 years old. And then from there, what we're going to do is we're going to, your numbers are going to go down, 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 down. So we come in with a magic bullet, the snake oil, which is the hormone replacement. Whether we use that with an herb or we use that with a synthetic or what they call a bioidentical, either way, you're assuming that there's lack of production. And many times, there may not necessarily be just lack of production. There could be many other complicating factors. So andropause can show up as many, many, many different problems. And I want to go over a few things with the concept of andropause. So some of the symptoms and complications that can be really troublesome to men can be low sex drive, difficulty getting erections or erections that are not as strong as usual, lack of energy, depression, irritability and mood swings, loss of strength and muscle mass, increased body fat, and even hot flashes. They can also start to have some issues with some bone density issues. What I see is that I would agree that most men that have no concept on how to take care of themselves are seeing hormone levels start to decline around 30 years of age. But I would also tell you that if you take care of yourself, this idea that you're going to get older and your levels are just going to drop, drop, drop is not true. I'm personally going to be 52 years old. The lab range that I use to test my hormone levels, testosterone, ranges from, I believe, 350 up to 820, and I continually crack in the 700s to 730 to 750 range. I'm not taking hormone replacement. I'm approaching this from how does the hormone axis work and what can I do to keep things working properly. Keep in mind also that when you approach this from giving the body more hormones, you're actually turning off the normal production of the body to make those hormones. So your system never has a chance to get itself back into balance if you take the synthetic, the bioidentical, or even sometimes some of these products that actually push and boost testosterone. So there's three different models within the hormone field. There's the conventional hormone replacement model that we're talking about. That's synthetic hormones, and over a time frame, taking these different things that may push testosterone levels. Then there's what everybody considers to be, this is safer. And I see these American Academy of Anti-Aging clinics that are out there touting that everyone's hormones are going to drop at 30. They make everyone believe that, which it's not true. They also come in and say, hey, well, instead of giving you the synthetic hormone, we'll give you a bioidentical hormone. So over a time frame, that's somehow better than the other. The answer is it's not, because you're doing the exact same thing. Both of them are manipulating the system. Both of them are not restoring the normal brain hormone axis to allow the system to start to work and regulate on its own. And then there's the deficiency model, the symptom model, and then the anti-aging model that we just talked about. And I got to tell you, these are very, very dangerous. In my opinion, when you mess with the hormones, it's very, very dangerous. I view hormones as downstream problems, meaning you got to fix other primary issues first. That is what's driving the hormonal imbalance in men and women. And this testosterone, taking testosterone, if you've seen people that cheat in sports and take these growth hormones and testosterone, and they can actually boost their system up and get faster and jump higher and put on muscle mass, you see how powerful these chemicals are. The functional model that's out there is much more in line with looking at what are some of the underlying imbalances there. That would support the ability of the body to make the hormones, reestablish a feedback, support the hormone biotransformation, support the receptor site response, identifying underlying cause of a hormonal imbalance, and also consider endocrine disruptors. Then there's another level above that the functional neurology docs look at, where they add some brain-based stuff in. And then there's where I'm going to, is what's called the Farley Neurobiomedicine Health System. We're going really deep into looking at this so that we can reestablish what's not working well, and go as deep as we can into understanding the normal physiology and getting things to work properly inside the body. We look at the brain, number one. We look at supporting the hypothalamus pituitary adrenal axis, because that has a lot to do with all hormonal levels. Number three, we want to support blood sugar, because blood sugar can be involved in many different things that can actually throw off all of your hormone levels. It can cause more conversion of testosterone to estrogen, and it can cause more conversion of testosterone to dihydroxytestosterone, which is the bad testosterone. We don't want that. Number four, support hepatic biotransformation. It means that these hormones have to shift and change in their structure so that they become the active form. Number five, we got to look at the gut, because the gut plays a major role in everything, and your normal microbiota. And if you have dysbiosis, we got to address that. That's a complex issue. Number six is looking at your balanced essential fatty acids. Essential fatty acids, almost everyone in the whole, at least United States, has an essential fatty acid imbalance. Our essential means we need to get these from our diet, and we're getting the wrong type, or we're all pounding fish oil, which may be the wrong type for you. Either way, we need those essential fatty acids that have a lot to do with your receptor site, which has a lot to do with the ability of the hormone testosterone, in this case, to work properly or not. And then number seven, cellular voltage. Looking at the ability of the mitochondria to work properly. If we don't address the mitochondria, we can't possibly get normal hormonal balance, because the mitochondria is the energy. It runs the entire metabolic rate, and it produces energy of the cell. And without having proper mitochondria function, your program will fail. A few things to go over with hormones. What you want to understand is this, is that endocrinology begins in the brain. So the hypothalamus pituitary is what runs all the hormones in the body. And in this case, we're talking about testosterone. So if we don't look at the person's brain and look at the functioning of the brain, and if the brain is working well or not working well, then over a time frame, we can't possibly expect to get proper hormonal balance. So this is a key area that no one even looks at. And we do a Super 7 examination here. We look at 7 different areas of the brain and the autonomic nervous system. We have you fill out detailed questionnaires that look at this aspect here. And then over a time frame, we run specialized tests to look at this to see what do we have going on, and whether that this is a component that may be involved with why your testosterone levels are not functioning properly. So what I want to go over with you is the 3 big concepts here. We have to have proper production of the hormones, we have to have proper conversion of the hormones, and we have to have proper clearance of the hormones. If we don't have that, we will never get good hormonal balance. So if all we do is look at this as a deficit, and whether we take the synthetic or we take the bioidentical, either way you're doing the exact same thing. You're going to turn off the brain's ability to then send signals down, in this case to the testicles and the adrenals, to produce this testosterone. And over a time frame, the testicles can actually shrink because they're no longer being used, because the brain believes you have enough. So it stops sending the signals down to the testicles to actually even produce the hormones of testosterone, and over a time frame the glands literally begin to shrink. So our program is very insightful. We look at the 7 different areas that are involved with why you may have low testosterone levels. If we need to get involved with running blood work on you, our blood work we run on someone, my expanded health panel and health profile, we run anywhere between 80 and 125 tests. We may also do saliva panels on you, depends upon what your case requires. But the testing that we run is extremely in-depth. We do not just assume because your blood work shows a low testosterone level that you're just going to have to jump in there and start with that. You may have to clean up the mess of some of the upstream problems to then get the downstream to start to work. And then gradually over a time frame, you can really get this whole system to upregulate and work properly. You can get strong again, have better issues with erectile dysfunction if you have that. A lot of men are carrying all kinds of weight around here. They start to get what I call the man boobs. You see them on the beach and you go, oh my gosh, I can't believe that poor guy over there. A lot of that is this hormonal imbalance. And it's not just about, again, a testosterone deficiency. Many times what's happening is your testosterone is over-converting into estrogen. And that's why we start to look like women. Literally, we start to look like women. So it's almost like sex change operation and you're taking the estrogen shots to look like a woman, and some men start to look like that. And the reason for that is because over a time frame, something is driving things to be off. In that case, it could be major blood sugar issues. And the blood sugar is off, and what happens is it upregulates an enzyme called the aromatase. And basically over a time frame, what happens is you convert more of your testosterone to estrogen, which makes you more look like a woman, act like a woman, literally, and all your male characteristics will go down because there's not enough testosterone. And that's one of the key areas that has to be looked at. Now the question is, if you have blood sugar issues, why do you have that? So every time you open up one can of worms, there's a deeper and deeper picture to look at. I'm an expert in going after which of the gears are off. This is why I call them the gears. So my model is mainly going after how things work. And this is the picture that I show here. So the gears, this is normal physiology. This is pathology up in here. So when all we do is run a blood test on you and say, oh, you have low testosterone levels, and we have no concept at all of what the underlying causes are. What are the mechanisms of action creating that inside of you? It's really going to bring you down a dead end. And as soon as we, again, start taking the hormone replacement, whether synthetic or bioidentical, you now have just disrupted the entire mechanism, and you'll never get it back into shape. And I'm not saying that at some point in time someone may not need some hormone replacement. They may, maybe. But the bottom line is you still need to address the underlying root functional causes. And what I've seen is if you address the underlying root functional causes, most of those mechanisms that you can identify through proper testing, then you get a proper diagnosis. My diagnosis may be 13 problems I find wrong that are all connected to why the person is having low testosterone levels. And then we set up a customized plan specific to that person, to that man, to reestablish this normal functioning. So everything that we do here is based on normal functioning. We really focus on providing superior customer service. We go really in depth under the lifting up the hood of the car here to really see what's going on, and we can set up a complete plan. So if you're sick and tired of having these signs of andropause, of having low sexual desire, low libido, erectile dysfunction, gaining weight, having depressive issues, having sadness, no energy, and you're wondering what happened to your mojo, we can establish an evaluation to look at what's going on behind the scenes, and we're experts at restoring the normal physiology. So I hope you found this interesting, and if you would like to set up the free consultation, please click on the button that says text, call, or email, and let's have a conversation. We'll have a conversation. I'm a real guy. By the way, again, I'm 51 years old. I don't take any hormone replacement, and my levels are at the top end of testosterone when I get my testing done. And it's been that way for the last 2 to 3 years, and I have plenty of other patients also that get very high levels when we look at these in proper testing. So this can be done for you, and you can get at what's going on. The other thing you want to understand also is if you're having a testosterone issue, your whole health is off. You should not have extremely low testosterone levels. So could this turn into a lot more problems down the road because you're not addressing these underlying causes? Could it also increase your risk of other diseases like neurodegeneration, like Parkinson's and Alzheimer's, and also increase your risk of other diseases like heart disease and cancer and stroke? Yes, the answer is yes. We have to stop taking these isolated problems and call them, oh, he's just got a testosterone deficiency. We have to look at the entire picture here. And we are experts on identifying, through proper testing, proper blood work, and properly specialty testing, what are your root functional causes, and then creating a customized plan specific for you to restore proper function and improve your level of healability and raise how your body works and functions. So I hope you found this interesting. Thank you, and have a great day.